SHINE stands for Serving the Health Insurance Needs of Everyone, and by everyone it means Medicare beneficiaries of all ages. Now, every year Medicare plans change, and perhaps your coverage should too. SHINE is here to help you make the best informed decisions regarding your insurance, and they also offer free screenings to see whether you qualify for any benefits, potentially saving you hundreds, even thousands of dollars. Here's more on the free service.
Our program is intended to help people deal with the complicated world of Medicare. So our goal, our mission, is to educate people so that they can make informed choices about their Medicare coverage. And we also screen people to see if they qualify for any benefits related to those health insurance programs that can lower their costs, whether it's their health care costs or their prescription drug costs.
We are a free program. We actually do have people come in sometimes and say, how much do I owe you at the end of this? And we really stress the fact that we are free, we are unbiased. We don't offer them just a narrow view of what's available to them. We make sure that they see all the options that are on the table. And honestly, this is very different than a situation where they might be dealing with a private insurance broker that will only give them a much smaller menu to choose from. So I think it's important for people to understand that we have no skin in the game, so to speak. We are most interested in finding them coverage that's best for them and that's going to save them the most money.
This is our busiest time of year. Between October 15th and December 7th, so we're right in the middle of it now, is a time when everyone on Medicare has a chance to change their coverage for the following year, so for January 1st. So this is, when I'm saying change their coverage, I'm talking about Medicare drug plans or what we call Medicare Advantage plans, which are HMOs or PPOs. And those plans can change significantly from year to year. So it's very important for people to review their coverage to make sure that they're still going to be in the plan that's going to work best for them for the next year.
The folks that clients who come in to see us will be meeting with are, for the most part, volunteers who have gone through a very rigorous training program to learn all the ins and outs of Medicare and related programs. Currently in the Metro West region, we have about 60 folks who are volunteers for us. Within that 60, we have a few that are paid staff at other local agencies, but for the most part, these are people who have either retired or are not working at various points in their life and really want to give back to the community in a very meaningful volunteer position.
It's very important that people bring their Medicare cards, and I do want to mention people should have received their new Medicare card in the mail. Everyone on Medicare is receiving a new card that no longer has their Social Security number on it. It's now just a randomly generated number. And those cards here in Massachusetts began being mailed out late July, and people should have received it by now. And if they haven't, they should call 1-800-MEDICARE to find out why they did not get their card. But they should bring their card. And they should bring a list of their prescription medications, and they should also check with their doctors to see what plans that their doctors participate in, so we can help them make the best choice that'll work for them, and hopefully in many cases we can save people a lot of money.
We encourage everyone, beginning at 3 months prior to the month of their 65th birthday, that they make an appointment and they come in and see a SHINE counselor. It may be that they're perfectly set with their current situation, particularly if they're working or if they have a spouse that works. But there's no one-size-fits-all, so it's well worth the hour of time, which is a typical SHINE appointment, for someone to come in and have that discussion and leave knowing what they need to do now, but also plan for the future as they decide how long they're going to continue to work or how long their current insurance is going to last. The best place to get information is to either stop by the Center at the Heights at 300 Hillside Ave, or call us at 781-455-7555 and ask to make an appointment. We also have a helpline where, for people that might just have a quick question and not want to meet with a SHINE counselor or can't meet with a SHINE counselor at this time. And so our front desk can always send those calls to our helpline, and we have volunteers that staff that and usually get back to folks within 48 hours for more non-critical situations or ones that don't require an appointment. The most gratifying thing is when you see relief on the face of an individual for whom you've saved money, or you found a solution, or just simply explained something that they felt was just too complex for them to understand, and you've broken it down into terms that make them realize what they're eligible for, and that they don't have to worry, especially as seniors as they enter into a phase of their lives where health may become more of an issue. So I think the most, certainly speaking for myself and probably for a lot of our volunteers, and I think this is what keeps them coming back every year to do more work for us, is that feeling of satisfaction that you really have made an impact on someone's life.